We're now joined by Amy Keefe, who is Manager of Authorization and Family Services at the New Jersey Sharing Network. Good to see you, Amy.
Good to see you too.
We're going to put up the website for the Sharing Network. People who know us know that for a long time we've been involved in public awareness around organ and tissue donation. That's what the Sharing Network is involved in. Amy, your brother, Brad, tell us about Brad and how Brad's experience, Brad's situation impacted your commitment to this movement.
So my brother was 32-year-old male. He got into an accident in March of 2016. He suffered a traumatic brain injury. There was no survival. So at that point, the New Jersey Sharing Network came into our lives. They introduced themselves and explained to us that my brother had registered to be an organ and tissue donor on his driver's license and to save lives. We didn't know it, but we weren't surprised. Being the type of guy that he was, we knew that he would definitely want to do something amazing in his last moments. So having him, he donated his liver, kidneys, and tissue. From there, I was working as a nurse in the emergency department, and I was doing a lot of volunteer work with the network at the time for our 5K. And from there, I decided there was something different I needed to be doing. We met the team from New Jersey Sharing Network when we were bedside with my brother in the hospital, and they were by far the most caring, amazing, supportive people we had ever met. And that resonated with me. And I felt that at that time, I needed to be part of this team because I felt like every family should have the opportunity that my family had. And that was to be part of something amazing and to have the support of the Sharing Network for life, because that's what we do.
Well, first of all, your brother, Brad, sounds like he was an extraordinary young man, 32 years of age, gave the gift of life to so many others. What message, Amy, every time we've done a program, a segment connected to organ and tissue donation, I ask this question, and obviously it's personal for you, but what is the message as there are 110, if my math is wrong, they'll tell me 110,000 Americans waiting for an organ, between 4,000 and 5,000. I'm not sure what the number is in New Jersey, but it's too many. What message would you want to share with everyone right now as they see the website, the website for the Sharing Network? What's the message with so many people waiting for an organ?
The message I have and the things that I see out in the field is talk to your family. Let them know your wishes. If saving lives and doing something amazing, being a hero in your last moments here on Earth, and there's so many people waiting and need organs. And if this is something you'd want to do, talk to your family. If you can register on our website. It's going to be on for you to see, but you can not only register, but you can also register with Donate Life America, and you can also just speak to your family. If something was to happen to you, God forbid, your family would know what your wishes were, and it takes it off the plate, and it's less decisions that they have to make.
There are a disproportionate number, a higher number of people who are Black and brown who are let's just say, things are not equal in terms of the need and also the response. And this is the question: what is the message that you would have for people in minority communities for whom organ donation is a huge issue?
So as far as, there's so much diversity in donation.
Right.
Everyone needs organs. This isn't, single to one specific group. So what I would say to anyone, including the African-American community, there's a lot of hypertension, there's a lot of diabetes, there's a lot of kidney disease, and if you're thinking that, this might affect someone in your family, in your group, in your church, your community, register as a donor, because you never know. And what they say about karma, Steve.
Yeah, I know what it is. But also, real quick, but Amy, on this, if I'm wrong again, tell me that organ donation is not based on color, meaning someone who happens to be Caucasian could say, I want, because on my license, that's what it says. It doesn't matter who it goes to.
No, it does not.
Help anyone.
No, I mean, my brother is being Caucasian. I know his organs didn't necessarily go to someone who's Caucasian. We've had written correspondence with them. This is what I do know. I do know that they were able to walk their daughter down the aisle because my brother saved their life, no matter what race, religion, or whatever it is. Across the board, people are in need of organs.
What did that mean to you and your family
I
to know
mean,
that?
we always knew that my brother saved lives. It never really, it wasn't too big of a thing for us to have to meet them necessarily, but when the recipients wrote us to thank us for the gift that he gave and to tell us that, one of them could fish with his grandson and the other one was able to walk his daughter down the aisle, those things just solidify the decision that my brother made. And it definitely solidified the decision that I would make to be a donor from there.
Amy Keefe is Manager of Authorization and Family Services at New Jersey Sharing Network, one of our longtime underwriters and partners in the effort to create greater public awareness around organ and tissue donation. Amy, thank you so much. You're, like I said, an amazing brother who gave the gift of life to so many others. Thanks, Amy.
Thank you.
I'm Steve Adubato. More importantly, that is Amy Keefe. We'll see you next time.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by the Turrell Fund, supporting Reimagine Childcare, MD Advantage Insurance Company, University Hospital, PNC, Grow Up Great, Horizon Blue Cross Blue Shield of New Jersey, Johnson & Johnson, NJM Insurance Group, NJ Best, New Jersey's 529 College Savings Plan, IBEW Local 102, and by these public-spirited organizations, individuals, and associations committed to informing New Jersey citizens about the important issues facing the Garden State. And by Employers Association of New Jersey. Promotional support provided by NJ.com and by bestofNJ.com.
New Jersey's early educators and childcare providers are more than twice as likely to live below the poverty line versus the general workforce. Reimagine Childcare, formed by a coalition in New Jersey, is dedicated to improving accessibility, affordability, and quality of childcare and reimagining the way we support these essential providers. Learn more by visiting reimaginechildcare.org.